Hi everyone, welcome back to another episode of Every Month Med. This month we are talking to Dr. Sojitra to talk about physical therapy and how the field has adapted during the pandemic.
So before we start asking our questions, we wanted to give you guys a little bit of an overview about the 6 main types of physical therapy. So the first type of physical therapy is pediatric PT, which is often used to specifically help make the most of physical growth and enhance skeletal and muscular strength by introducing movements in adolescents who may have never experienced these movements before. Another type of PT is geriatric physical therapy, which focuses on using muscles in a safe way for older patients to decrease the risk of injuries. The third type of PT is orthopedic physical therapy, which is designed to help patients recover muscle strength following detrimental injuries. The fourth type of PT is cardiovascular and pulmonary physical therapy, which is used to increase endurance and key muscles for people with heart problems or blood circulation problems. Um, and the fifth type of PT is vestibular rehabilitation, which focuses on overcoming inner ear issues that may disrupt balance.
And another type of PT is a neurological physical therapy, and that focuses on incorporating therapeutic movements to lessen the effects of neurological problems on the muscles. And it also can make the effects more manageable. And so now we're going to introduce our special guest for today, Dr. Hetal Sojitra. Dr. Sojitra is a physical therapist here in New Jersey. She owns 2 practices, one in Montville and one in North Brunswick. Her practice is called Care and Cure Therapy. Furthermore, Dr. Sojitra studied physical therapy in India at the University of India. When coming to the US, she pursued a higher education and earned her doctorate in physical therapy at the Utica College. Without further ado, here's Dr. Hetal Sojitra. Welcome, and thank you so much for being here today.
Hi, thank you for having me.
Thank
Looking
you.
forward to talk to you.
Yes, we're super excited to hear all about physical therapy. So our first question is, can you tell us just a little bit about yourself and your career?
Yes. My name is Dr. Hetal Sojitra. I'm Doctor of Physical Therapy, and I'm working in the field for almost more than 10 years. I did my doctorate from Utica College, upstate New York. And I have worked with various physical therapy settings, including, like hospitals, acute care rehab, short-term rehab, long-term rehab, nursing homes, and outpatient orthopedic. Personally, I like to work with orthopedic outpatient setting, and currently I own my own physical therapy practice, as you guys introduced. It's named Care and Cure Physical Therapy, and one is in Montville and other one is in North Brunswick. That's
Perfect. What kind of approach is taken when designing treatments for patients, and how do these treatments affect from patient to patient?
Yeah, so when patient first comes for physical therapy, we have to do detailed evaluation. And based on my assessment and clinical judgment, I create a treatment plan for patient, which is definitely different from individual. So I personally think appropriate evaluation is very important for patient for us to create appropriate treatment plan, and that the way we can provide the best treatment to patient. Physical therapy treatment usually varies based on individual symptoms.
Mm-hmm.
However, most of the patients do need physical therapy exercises, but the types, duration, it's definitely vary based on patient symptoms. For example, patients with post-surgical conditions have totally different care plan as compared to patient who just comes with only osteoarthritis or sports injuries or general neck pain, back pain. So everybody does have different physical therapy exercises, but basics definitely be the same.
Yeah.
I think that's really interesting just to hear how each treatment plan is like really personalized and specific to an individual. I just have a quick follow-up question to that. Do you find that age affects treatment plans?
Yes, absolutely. Age does affect treatment plans because everybody has a different tolerance to exercises for older individual versus younger individual. Most of the time when the older individual comes for physical therapy, for their refer for physical therapy, basically we just do a lot of generalized conditioning and strengthening exercises because their diagnosis is usually like difficulty walking or osteoarthritis. So it's basically generalized conditioning versus younger individual, they can tolerate higher intensity exercises such as more of plyometrics, more flexibility strengthening than older individuals. So, and also older individuals do require a lot of rest time in between as compared to younger. And yeah, that's how it's definitely different. Everybody gets benefits from it, but basically the purpose of physical therapy is make patient functionally independent. So that's how it's very different in both age groups.
Right.
Super
Thank you.
interesting.
Yeah, that's like clarifies a lot of questions about age and the factor on physical therapy and their movement of range as well. So I have another question, which is how has the COVID pandemic changed the nature of your work?
Yes. Oh yeah, my God. COVID has been changed for like, as you know, the COVID pandemic has changed the entire world, including the healthcare. Since it is highly contagious condition, initially, during early outbreak, I would say in March, I would have to close the office for almost like 6 weeks, and I wasn't seeing any patients. Everybody was so afraid, and people wouldn't know what to do, and people were so scared. And it was so overwhelming and frustrating. So I had to close the office, but then I found another approach. It's called telehealth physical therapy, which is video consultation and treatment, which is definitely different than seeing patient in person. Yeah, but I started doing telehealth and it really helped patient. Well, in which patient stays home, I stay home or I go to office, there's nobody. And, like this or Zoom meetings, we see patients one-on-one. And, it was very quite helpful for patients. People were so afraid because, they don't want to be with the people. So it was very helpful to do the telehealth physical therapy. But, unlike any other businesses, I did not have to change much because we were always been wearing masks and all. So by the time when we came back, right now I'm back to office like full fledged and seeing patients. I think now patients are very comfortable coming in the office at this time. So I did not have to do much, but yes, we always have to clean the equipment. After every patient, everybody has to wear masks. Now we make sure the office, everybody wears masks, the patient wear masks, I provider wear masks, and we take the temperature before the patient comes. And also we just get the detailed history. Every time they come, we ask, okay, have you been exposed to everybody? If you do, you have to let us know. Or if you feel the symptoms, you could just go get tested and give us the results like, okay, you're negative or so and so. Because now people are very comfortable coming in. Now we see a lot of patients right now, but then luckily I have enough room. So there's not many people at the same time and everybody wear masks. Every time they come, we just say, okay, how you feeling? And I think right now everybody are very honest. Being based on my experience, I'm saying if they say, hey, I was out with the friend last night and my friend said, oh, I got positive, so I'm not going to come to physical therapy until I go get tested.
That's good.
Yeah, so that's how it's helping. I feel like people are more aware right now, and hopefully, this is going to end soon. But
yeah,
it's great to see all the safety precautions you've taken inside the office as well.
Yeah, especially to prioritize your patients.
Yeah, it's really very important because if patients are not going to feel safe, they're not going to come, and myself, I have to be safe too, because we come home getting things home. So it's important. So I'm hopefully, and I'm glad it's working out. Thank God.
Yes. Yeah. So I have a quick follow-up question to that. So back in March, when you were utilizing online platforms, did you find that consulting through these online platforms was like drastically different than consulting in person with patients?
Yes, absolutely. Consulting patient in online is quite challenging, and it's very different than we see a patient in consulting in person. Because whenever we do physical therapy evaluation, it has some different type of aspects, like what you do. For instance, you have to check the test and measures. Like if somebody comes with lower back pain, you just say, okay, you have to check the range of motion, any testing done, like if the pain going down to your legs. So those type of testing you have to done, we actually physically touch the patient. But then with online, you cannot do such thing. For like, if you want to check the swelling or mobility or tenderness, meaning if you press somewhere, it doesn't hurt. So it was really difficult. But then then we came up with some different treatment plan or different assessment tool that I would just tell patient, hey, how far you can bend down to touch your toes, or how far you can lift your leg, and does it hurt when you do that? So those type of things can help at least for us to check some generalized strength, so we can get idea to make a treatment plan. But it worked, but it's still a little different than seeing a patient in person.
Right, I can imagine, yeah. So how have your patients felt after adapting to the online platform? Do they feel like physical therapy is still helping them in the ways that it would be in person?
Yes, it's a very interesting question. And I felt it very, initially it was very different for me. And personally, I thought I'm based on my experience, I thought, oh, this is never gonna work. But it did, surprisingly it did.
That's awesome.
My patients felt so great after adopting this different treatment approach. Telehealth physical therapy treatment is like one-on-one. So I usually spend 1 hour with each patient when I do telehealth physical therapy. And till date, I still do some telehealth, because even if everybody's comfortable coming back to the office, some of them don't.
Right.
So when somebody calls, I said, hey, okay, we are back to office. Do you want to do telehealth or you want to come to office? So they said, okay, we're going to do telehealth. So then I do a video visit. So what happened that, right after the whole thing started, patients said, okay, we cannot get out of the house and all. So I started working in, and everything was really closed, and patients were like, okay, what to do? We don't know what to do. So then I started consulting little by little. I just say, okay, you know what, you do this exercise, do this for 10 times. It's like basically treating patient in person in the office. But the difference was they don't have the equipments, like, exercise bike or so.
Right.
But most of them could find some sort of equipment like TheraBand or dumbbells or exercise ball. Now people were, I think, more health conscious right now, so they do have most of the little things at home. And then I came up with a different treatment plan that they can do at home with using whatever they have at home. And it worked great. And then, I have seen a couple of post-surgical patients, and personally, I thought it wouldn't help, but it did. And we see the results, and patients saw the results, and it was good. It was very good. So I'm glad.
The adaptability is just amazing of how the pandemic has just changed.
Yes.
Like this whole field is just incredible to see.
Yeah, I would never thought that telehealth would work. I mean, people say, okay, the doctors, for example, the PCPs, they started doing telehealth. Yeah, that's fine. Like, okay, you have pain and ache. Okay, I'm gonna write this medication. You're good. But for PT, it was a little difficult, but it worked. And I personally thought I would never be able to work from home, but I did, and it was good.
Yeah, it's great to see how like Zoom has become such a big part of our lives. Technology has adapted as well during this pandemic to like help us like throughout this pandemic.
I know. That's great.
So our next question is, how do you think the pandemic will change the nature of physical therapy going forward? So I know this is like, we don't know when this is going to happen, but when we return to like normal life.
Hopefully soon. I know it's crazy whatever we're going through right now, but I don't think so there will be any major changes personally when we go back to normal life, because I personally feel like we're going to be wearing this mask for a quite long time.
Right.
Yeah. And even after this will end, I don't know. I mean, I got vaccinated fully, but still, I don't think so. It's going to be taking like 1, 2, 3.
Yeah.
Actually, at this time, like almost last year, this whole thing started, right? So now it's been almost a year, and I think people are getting more comfortable with coming out. And initially, because a lot of surgeries were closed because of the COVID thing, all elective surgeries were, so I wasn't seeing any post-surgical patients. Now everybody were waiting for it. Now they went back to surgery, so now they're coming back to the office. And most of my patients are comfortable doing exercise wearing the mask. Good. So it was absolutely good, because, this is not like extraneous exercises. Right. This is like basically very focused exercises for a particular muscle group. So patients do get a little tired, but then they just take a break, and then they just kept going. And I think it's going to be okay, because for me, especially in field of physical therapy, we always have to wear gloves, even before the pandemic, we were always cleaning the equipment. So I don't think so anything would be changed moving forward. But let's see what happens.
Yeah.
That's interesting.
Yeah, it's just interesting to see how like the pandemic has totally changed everything.
Yeah, everything. I know. I thought it would be so difficult. Personally, I thought, oh my God, I don't know if I'll be able to see a similar amount of people, as I was saying before the pandemic. Will be patient be able to comfortable working out, inside? And then, as you guys know, gyms are also open right now, and people working out at the gym with the mask on. But physical therapy is totally different than the gym. Although we do some exercises, but it's called therapeutic exercises. It's not the same thing as people do in the gym.
Right.
And then people are comfortable doing it. So, it's working great. Let's see what happens after the normal life begins.
Yeah.
Yeah. So our next question is, how do you think physical therapy will continue to adapt as technology continues to expand?
Yes. See, technology, I feel is an integral part of all type of businesses, including physical therapy. And for physical therapy, the technology is like telehealth physical therapy. It has been in the business for quite some time, but now it's getting more. And I wasn't thinking that it is going to be like this, this much more. But now people are getting more comfortable doing telehealth physical therapy. I think because of the pandemic, a lot of PT places turn to telehealth physical therapy, and it's because of the technology, because it's very easy. Anybody can do it from home, wherever they want to do it. But I also did telehealth, and I was surprised that I was able to work, and I was able to help people when they were stuck in home with pain. It's only happened because of the technology. So there are so many software right now available that PTs can assess and consult and treat the patient using the technology. So I personally believe the technology will play a huge part in our daily life, and I'm so glad because of technology I was able to see my patient, and I was able to help people when they really need it. When they're stuck in the home, and I'm so glad for that. So yeah, that's a good thing.
Definitely. I think technology has revolutionized almost every field, and in the pandemic has become really handy.
I mean, they have taught us so much stuff, and who would think like we were totally living a totally different life right now because of the pandemic, and who would think, it's very different, but
Definitely.
that's a good thing.
Yeah. So our next question is, do you have any advice for people that want to go into physical therapy?
Yes, I have a lot of advices for them. Usually, what happens if someone thinks they need to go for physical therapy for treatment, it is important for them to go for a timely manner. Normal aches and pains, it stays for 24 to 48 hours. Those pain, aches and pains is totally different than the pain with underlying pathology.
Yeah.
So what happened, normal pain should go away in 24, 48 hours, such as, pain after working out, or if you have to sit down some physical activities, then those pain is different. But if someone feels very unusual pain, which is not going away for more than 7 days, then I would say you should pick up the phone and make an appointment and go to the doctor. Usually what happens, I have seen a lot of patients, they just wait and wait and wait, and then by the time they come, the damage is already done. They have whatever damage, the muscle, tendon, joint, whatever it's there. So we shouldn't wait too long. Otherwise, physical therapy, what is usually done, that when you don't wait until the pain is unbearable. For instance, I just have seen this patient with frozen shoulder, and he said, okay, you know what, it was better, but I thought it was going to go away. It was going to go away. By the time they decided to go to the doctor, it was too late. That it was like so stiff. So it's really important that if you feel something not right, then try not to Google and try not to find exercises for yourself. I mean, it's very important. It's okay to Google and look for, okay, what's going on with my own body, but you cannot diagnose yourself. I've seen patients go to the gym, do exercises, and they get hurt themselves. And then they said, oh, no, I'm going to be better. I'm going to be okay. I'm going to do this exercise. Okay, YouTube said this. Yes, YouTube is great tool. Google is great tool, but they're not going to assess your body. Like, they're not going to check your muscle strength. They're not going to check, okay, you do this, then you're going to do this. It's very different. And physical therapy, it's not only exercises. It's also a lot of hands-on. Mm-hmm. Which is like manual therapy, joint mobilization. Along with that, we use some electrotherapy. It's like physical modalities such as ice pack, heating pad, electrical stimulation, everything combination together, which will help the patient. And physical therapists can guide you through your exercise routine. Also, they tell what type of stretches are good. And I personally feel all exercise has to be performed in appropriate posture. Because if you're not going to use appropriate form, you're going to be ending up working a different muscle that you don't want to do it. Right. And then you're going to damage that particular muscle, or you do a lot of overcompensation when you work out. So it's better to go for qualified physical therapists. If you feel like you need something, you just go and tell them what happened. And so physical therapists can help the patient to learn appropriate stretches or exercises, whatever they need. And they can help you to make your best workout an effective way. And also it helps you to improve your overall health.
Right. Yeah. I think it's so great to hear how physical therapy, like WebMD and Google, can only diagnose so much. It's like you need to see an actual person, an actual qualified doctor to like help people when they're injured with injuries and all that stuff.
Yes, it's very important because and people get very scared, like it gets panic. Oh my gosh, I may have torn my labrum, I may tore my rotator cuff or something. Yeah, but and then they just Google, okay, exercise for rotator cuff tear, right. And then they start following there, and which is not appropriate way to do it, because it can help, but it can damage too. We don't know what it's gonna how it's gonna help.
Want to be careful.
Yeah, just have to be careful. That's it.
Yeah. So our last question is, how do you help teens in particular understand the importance of stretching before and after exercising? Because I'm sure you see a lot of teen-related injuries and teen-related broken arms and broken legs.
Yes, of course. Stretches is very important before and after exercises for almost everybody, including teenagers. Also, yes, a lot of teenagers right now, as you guys said, with COVID, very frustrated being in the home. So they're getting crazy in working out. And most of the people, and which is good, they spend a lot of time working out, which is good. Working out is makes you healthy in general. It's not only to losing weight, but to make you feel better. Has also a lot of mental effect, like mentally make you feel better. So there are mainly three types of stretching: static stretching, dynamic stretching, and ballistic stretching. Ballistic stretching does not really preferred by doctors. It's usually populated among the athletes, because those type of stretches, it's like very bouncing and jerking motion, which usually pushes the muscles beyond their normal range of motion. So not everybody can tolerate it, but static and dynamic stretches are very important stretches, which is preferred by other people. Usually static and dynamic are performed before and after exercises. The static stretches is like when you stretch and you hold it in for 10 to 15 seconds. It's usually very gentle stretching and without any risk of pulling the muscles beyond their normal movement. So it really helps after workout. And it involves, like, when you're done workout, after you do this, it helps to loosening the muscle and it decreases the chance of having some injuries.
Yeah.
Dynamic stretches involves the movement. Dynamic, the name sounds dynamic, meaning you're going to move. So it doesn't hold. You just have to constantly moving, and then you don't need to hold it for anything. But that stretch usually performs before exercise in order to get yourself or your body ready to working out. So those type of stretches, you do it before exercise. And the stretches before exercise, the benefits are like I would prefer everybody should do 5 to 10 minute stretches before you start your workout and 5 to 10 minutes after. Because when you start, it helps you to improve the flexibility, range of motion, increase the blood flow, and then it's improve your overall performance. And however, after workout, if you do those static stretches after workout, it helps you to decrease the pain and reduce the chance of injuries. Because what happens when you work out, our body releases a substance called lactic acid. So that lactic acid causes soreness in muscle. So when you perform these static stretches, what it does is eliminate the lactic acid, like amount of lactic acid is they just reduce it. So then you feel less soreness and this is less chance of injury. So in general, it's very important to stretch and it really helps either way, before and after.
Right. I think that's so interesting. I did not know about the different types of stretching.
Me neither.
The types of stretching you should be doing before and after exercise. I think that was very informative for everyone, but even teenagers.
And I didn't know about the lactic acid either. That was really interesting to hear about. Yeah.
It's like so many different things in the human body physiology and all those things and how it affects with exercises. It's interesting. And it's very interesting to see how it affects our body. A lot of people don't know much thing about it, but it's a good thing.
Yeah, I think stretching is crucial.
Yeah. Definitely is. Well, thank you so much for being here and for answering all our questions, Dr. Sojitra. The information you've provided has been excellent, and I'm sure all of our viewers will definitely benefit from it. And thank you to everybody who is listening in on another episode of Every Month Med. We hope you guys enjoyed it. And as always, if you have any suggestions, please leave a comment below.
Thank you so much, Dr. Sojitra.
Thank you for having me here. I hope this information helps everybody and your viewers.
It definitely will.